You just had a minor outpatient procedure. You step out of the clinic, feeling stiff and a little unsteady, and you find yourself staring down a busy city street. In our hyper-connected world, the reflex is almost automatic. You reach into your pocket, open an app, and tap a button to summon a standard rideshare to get you home quickly. But that convenience comes with a set of uncontrolled variables. Your driver might park across an icy intersection or wait on the other side of a crowded crosswalk, expecting you to navigate curbs and uneven pavement alone. Those gig economy networks are built for speed and volume. They can easily overlook the physical fragility of someone actively recovering from medical treatment. Treating a post-medical trip like a routine daily commute introduces unnecessary physical and emotional risks to a vulnerable patient. This chart maps patient mobility levels, highlighting a middle ground between independent and wheelchair-bound called ambulatory transportation. It provides a solution for passengers who walk with canes, walkers, or rollators, but still require professional support to move safely. Think about a typical rideshare driver waiting inside their car while you approach. An ambulatory driver, on the other hand, is trained in dedicated patient assistance protocols. That means they are physically outside the vehicle, anticipating trip hazards. They understand how to safely manage uneven pavement, and they know how to give you the time you need without rushing you. Proper physical support requires preserving a patient's independence and dignity. It involves offering a steady presence and opening doors, rather than over-assisting or forcing movement. Through professional, structured assistance, your physical safety is prioritized long before the vehicle's engine is engaged. Once you are inside, the environment needs to match that level of care. There is a contrast between slipping into a cluttered, unvetted taxi and sitting in an immaculate, strictly maintained medical transit vehicle. That care extends to the way the vehicle moves. Professional medical transit relies on defensive driving, eliminating sudden braking, avoiding rapid acceleration and sharp turns. If recovering from surgery or a difficult treatment, even a minor jolt has physical consequences. Sudden jostling can exacerbate surgical pain, trigger dizziness, and increase post-treatment anxiety. Navigating unpredictable traffic safely requires controlled momentum. It takes deliberate planning to ensure every stop and start feels seamless to the passenger. When a patient is recovering, driving with this level of precision serves as a necessary safeguard, preventing the transit experience from aggravating the very condition the doctor just treated. Beyond what happens on the road, there are operational protocols operating behind the scenes. These administrative standards separate everyday transit drivers from healthcare-aligned professionals. One element is privacy awareness training. A trained driver shields your sensitive medical details, preventing intrusive questioning and ensuring your personal circumstances are never discussed in public spaces. There are also parameters for emergency awareness training. If a passenger becomes confused, reports distress, or experiences shortness of breath during the trip, the driver has specific protocols to follow. The driver does not administer medical treatment. However, their ability to remain calm and instantly interface with emergency dispatch prevents small issues from becoming catastrophic. These invisible layers of training elevate the driver from a logistical chauffeur into an active monitor of your well-being. This timeline illustrates a complete medical procedure, challenging the assumption that transportation exists as a separate event from the medical treatment itself. Notice how the transit to clinic and transit home blocks are highlighted as active phases of the treatment cycle. Instability in those outer phases creates negative effects. Arriving late, stressed, or in pain sabotages the efficacy of your medical appointment and can delay your recovery. Ambulatory transportation provides the essential logistical continuity that secures the start and end of the modern healthcare journey. Protect your recovery. Book a medically aligned service like Swift Aid Transport for your next appointment, and ensure your ride acts as a dedicated support system rather than another obstacle.